You know how we all thought measles was like a thing of the past?
Yeah, like something our grandparents used to talk about.
Right. Like, gone, eliminated, done.
Exactly.
But here's the thing. It's back, making a comeback.
And it's not just a few isolated cases either. It's making headlines, even in places where, lots of people are vaccinated.
Exactly. So what's the deal? What's going on with measles? That's what we're going to dive into today. The whole story from like the very beginning to what's happening now.
It's way more complicated than people realize.
That's for sure. So first things first, for anyone who might not remember, what exactly is measles?
Well, most people think fever and rash, right?
Right, like the classic symptoms everyone knows.
But measles can actually be pretty rough. It's highly contagious, and you can get all sorts of complications like pneumonia,
Oh, wow.
encephalitis, even vision loss in some cases.
I had no idea it could be that serious.
And there's this other thing. Researchers are finding that measles can have these really long-term effects on your immune system. They call it immune amnesia.
Immune amnesia? That sounds kind of scary. What does that even mean?
It's like measles can wipe out your immune system's memory of past infections, so you're more likely to get sick again even years later.
So your body kind of forgets how to fight off stuff it already dealt with.
Exactly. It's like hitting the reset button on your defenses, which is not good.
Wow, I never knew that. So, okay, where did this measles virus even come from? Like, how far back are we talking?
Well, it's actually a bit of a mystery. There are a couple of main theories. One is that it evolved from canine distemper, the virus dogs get.
Oh, interesting.
The idea is that it jumped from dogs to humans, probably sometime after we started domesticating them.
Okay, that makes sense. So our furry friends might be the original source. What's the other theory?
The other one links measles to rinderpest. That's a cattle disease that was actually eradicated back in 2011.
So either our pets or livestock. That's fascinating. But how do we know when it actually first appeared in humans?
That's the tricky part. Some researchers think it emerged maybe around the 11th or 12th century.
Based on what?
They look at historical descriptions of outbreaks and try to match them up with what we know about measles now.
I can see how that would be difficult.
It is,
Right.
because back then they didn't have the same medical language we use today.
Right, so trying to figure out exactly what they were dealing with is almost impossible.
Right. And then some researchers think measles might go back even further, like maybe to the 6th century BCE, based on genetic studies. But it's still really hard to say for sure.
It's like a medical puzzle from centuries ago.
Exactly.
Well, speaking of figuring things out, wasn't there some physician back in the 9th century who made some important discoveries about measles?
Oh, you mean Al-Razi?
Yeah, that's the one.
Oh, yeah, he was a really big deal. Persian physician.
Right.
One of the most influential figures in early medicine, really. And he was the first to clearly distinguish measles from smallpox.
Which is huge when you think about it.
Absolutely. Back then, people just lumped all these diseases together, so figuring out they were different was a big step.
So what was his approach to medicine like?
Well, he was a big believer in observation, carefully watching his patients and recording everything he saw. And he wrote a lot about measles. That's actually how we know so much about his ideas.
That makes sense. So what kinds of things did he think caused diseases?
He believed in the 4 humors: blood, phlegm, yellow bile, and black bile. That was the prevailing medical theory back then.
The 4 humors. Seems a bit outdated now.
Yeah, definitely not how we understand things today. But, for his time, he was incredibly advanced.
It's amazing how much medical knowledge has changed.
Totally.
So let's shift gears a bit. We talked about the origins of measles, but what about its spread around the world? That must have been a whole other chapter.
Yeah, pretty dark chapter, unfortunately. The age of exploration with all the colonization and stuff, it brought more than just new trade routes.
Yeah, it brought diseases too,
Exactly. And measles was one of the big ones that hit indigenous populations really hard.
like in the Americas.
Especially there. They had no immunity to these new viruses Europeans brought with them.
Yeah, I know smallpox gets a lot of attention, but measles was right up there in terms of devastation, wasn't it?
Oh, absolutely. Measles, along with smallpox and other introduced diseases, it just wiped out entire communities. It's a really tragic reminder of how interconnected our world is and how vulnerable we can be to these, invisible threats.
Right, like we can't forget that even today. So back in Europe, was anyone making progress in understanding measles, like beyond Al-Razi's work?
Yeah, there were some important observations happening in the 17th century, actually. Thomas Sydenham, an English physician, he was really meticulous in describing measles.
So like more detail than what Al-Razi had documented.
Oh, yeah, way more. He really laid out the whole progression of the disease, the stages, the rash, everything.
So he was really trying to pinpoint what made measles unique.
Exactly. And that was important because it helped people understand it better and treat it more effectively. His work really solidified the idea that measles was its own specific disease with a predictable course, not just some random collection of symptoms.
So he was laying the groundwork for future research, basically. Did anyone try to, develop a treatment or a way to prevent measles during this time?
Well, there was this guy, Francis Home, a Scottish physician who thought he could.
Oh, really? What did he do?
Well, he was inspired by the idea of smallpox inoculation. They were starting to do that back then, and it was showing some promise.
So like a very early form of vaccination.
Exactly. But his methods were, well, let's just say they were a little less than ideal.
Less than ideal how?
He would take blood from sick people and then try to introduce it to healthy people, thinking that would give them a mild form of the disease and make them immune.
Whoa, that sounds kind of risky.
It was incredibly risky and honestly kind of gross. It didn't really work either, and it could actually spread the disease further.
Yikes.
But even though his methods were really flawed, he did help establish that measles was caused by something contagious in the blood, which was an important step.
Okay, so even a bad idea can sometimes lead to some progress. So where do we go from here? Who picked up the torch after Francis Home?
Well, the story takes us to the Faroe Islands in the 19th century. There was this big measles outbreak there, and it gave researchers this amazing opportunity to study the disease in this really isolated environment.
Why was that so important?
Because it allowed them to track the spread of the disease in a way they couldn't do in a bigger, more connected population. They could really isolate the variables and make some key discoveries.
So who was the researcher who made these discoveries?
A Danish physician named Peter Ludwig Panum, he was meticulous in his observations. He figured out the incubation period for measles, how long it takes to show symptoms after you're exposed.
And how long is that?
About 10 to 12 days. He also traced how it spread from person to person, confirming it was through close contact.
So he was like a disease detective figuring out all the clues.
Exactly. But his biggest finding, the one that really changed things, was that people who had already had measles, they never seemed to get it again, even when everyone around them was sick.
So they were immune.
Yes, and this provided really strong evidence for the idea of lifelong immunity after measles infection.
That must have been huge. Like finally, proof that you could be protected from this disease.
It was a major turning point, and it really fueled the hopes that a vaccine could do the same thing, provide that same kind of lasting protection.
So Panum's work in the Faroe Islands was a crucial step towards developing a vaccine. That's incredible.
Absolutely crucial. It set the stage for what would come next.
All right, so Panum's work really sets the stage for the race to develop a measles vaccine. Where do things go from there?
Well, the real breakthrough comes in 1954 with these two researchers, John Enders and Thomas Peoples.
And they were working at?
Boston Children's Hospital.
Yeah.
And they managed to isolate the measles virus.
Oh, wow, that must have been a huge deal.
Huge. It was like the missing piece of the puzzle. Before that, you couldn't really study the virus in detail or develop a vaccine.
So isolating it, what did that even involve?
It was a really long process, lots of trial and error. They had to figure out how to grow the virus in human cells in the lab, which was tough. But once they did that, it opened up a whole new world of possibilities.
So once they had the virus, was it smooth sailing from there? Like, did the vaccine just appear overnight?
No. It took another 9 years of research. They had to make sure the vaccine was safe and effective, that it would actually work in people.
And that's a lot of testing and trials, I imagine.
Oh, yeah. Tons of it. And there were some ethical questions they had to grapple with, too, especially early on. Some of the trials involved institutions for disabled children, which, looking back, is pretty controversial.
Yeah, that raises some really important questions about how we conduct research and who participates. So the measles vaccine finally gets approved in 1963. What happens then?
Well, in countries that started widespread vaccination programs, the number of measles cases just plummeted. It was incredible, really.
That's amazing, like proof that vaccines could really work.
Exactly. A major public health victory. But, and there's always a but, right?
Yeah, of course there's always a catch.
Not everyone had access to the vaccine right away. A lot of people, especially in poorer communities, they couldn't afford it or they didn't have access to health care.
So even though the vaccine was there, it wasn't reaching everyone who needed it.
Exactly. It's a reminder that scientific advancements are great, but they don't always translate to equal benefits for everyone.
Yeah, access is such a crucial piece of the puzzle. Okay, so the vaccine is out there, cases are going down, it seems like we're on the right track. But then 1998 happens.
Oh, yeah, that was a big setback.
The Lancet article, the one that claimed there was a link between the MMR vaccine and autism.
Yep, that one.
I remember that causing so much fear and confusion. What was the deal with that study? Was there any truth to it?
None whatsoever. It was completely debunked. The data was fabricated. The researcher had conflicts of interest. The whole thing was a mess. The Lancet even retracted the article.
But the damage was done, right?
Oh, yeah, big time. That one study really fueled the anti-vaccine movement and created a lot of mistrust in vaccines in general. It's crazy how much influence one bad study can have.
And we're still dealing with the fallout from that today, right? With vaccine hesitancy and all that.
Absolutely. It's a reminder that misinformation spreads like wildfire, and once it's out there, it's really hard to undo the damage.
It's like we took this huge leap forward with the vaccine, and then this one article pushed us way back. So where does that leave us now? What's the situation with measles globally?
Well, remember how we talked about measles being eliminated in the U.S. in 2000?
Yeah, that seemed like a huge milestone.
It was, but unfortunately, we're seeing a resurgence, not just in the U.S., but in other parts of the world, too.
Wait, a resurgence? But why? I thought we had this thing under control.
It's a few things, really. Vaccine hesitancy is definitely part of it. People are still scared, even though there's no evidence to support the link between vaccines and autism. But there are other factors, too, like the COVID pandemic. That really disrupted vaccination programs all over the world.
Oh, right. Because everyone was focused on COVID and other things fell by the wayside.
Exactly. And when you have gaps in vaccination coverage, it creates opportunities for diseases like measles to spread. Plus, there are still parts of the world where people just don't have access to the vaccine.
So it's a combination of factors.
Yeah, it's complex, and it shows how interconnected global health is. What happens in one part of the world can easily affect other parts.
So, given all that, can we ever truly eradicate measles? Is that even possible?
It is possible, technically. We have the tools, you know. The vaccine works, it's safe, and it provides lifelong immunity. But the challenge is getting it to everyone who needs it, and that's a huge undertaking.
So it's not just a scientific problem, it's a social and logistical one too.
Exactly. We need global cooperation, political will, and resources to make it happen. Plus, we have to keep fighting misinformation and building trust in vaccines.
It's amazing to think how much we've learned about measles. I mean, it seems so simple at first, but there's so much more to it than I ever realized.
It really highlights how complex these public health issues are and how we can't just focus on one disease or one country in isolation.
It's all connected. So as we wrap up this deep dive, what are some of the key takeaways for our listeners?
Well, I think the biggest one is stay informed. You know, keep up with the latest research, the recommendations from health organizations, and any outbreaks that are happening.
So where should people go for reliable information?
The World Health Organization, the CDC, those are always good places to start. They're constantly updating their guidance based on the latest science.
Good to know. What else could people do? Aside from staying informed, I mean.
Don't be afraid to have those tough conversations about vaccines with friends and family who might be hesitant.
Yeah, those can be hard.
They can be, but they're so important. And it's not about lecturing people or getting into arguments. It's about sharing credible information, listening to their concerns, and trying to find common ground.
Because ultimately, we all want the same thing, right?
Yeah.
To protect ourselves and our communities.
Exactly. Especially those who are most vulnerable, like young children and people with weakened immune systems. They're the ones who are most at risk if measles spreads.
So are there any organizations people can support if they want to get more involved?
Absolutely. There are tons of great groups out there working to increase vaccine access around the world. Every little bit helps.
Whether it's donating or just spreading the word.
Exactly. Even small actions can make a difference.
Well, this has been an incredible journey. I feel like I've learned so much about measles, and not just about the disease itself, but about the history of medicine, public health, and the challenges we still face today.
It's a reminder that the fight against preventable diseases is never truly over.
We have to stay vigilant and keep working together. And on that note, we've reached the end of our deep dive on measles. We hope you found this exploration as fascinating and informative as we did. Don't forget to subscribe for more deep dives into topics that matter. Until next time, stay curious, stay informed, and stay healthy.